There are three main reasons to focus research on atrial fibrillation. One is that atrial fibrillation is a very common arrhythmia that is reaching epidemic proportions in our population. In 25 years, it's estimated that in excess of 3 million people in Canada will suffer from this arrhythmia. It's a greater problem as our population ages. The second main reason is that it's a very expensive condition to manage. Using US numbers, in excess of $10 billion a year is used to manage patients with atrial fibrillation. Lastly, our management strategies are not perfect for this condition. We use various methods to try and control this common arrhythmia, from medications to procedures, and unfortunately, these strategies are not highly effective. So we have many reasons to try and understand the pathophysiology of this condition better. And what we've learned in recent years is that many patients with this arrhythmia have a very strong genetic basis for the condition. If we can identify those genes that lead to atrial fibrillation in people and understand the proteins that they make and how these proteins function in the heart, we will be able to develop better drug therapies to manage these arrhythmias for patients. Atrial fibrillation is the most common heart arrhythmia that affects humans. And what we know is that as the population ages, I'll re-answer that. Atrial fibrillation is the most common arrhythmia that affects humans. And it's age dependent in its onset. If we take a population of individuals in the age range of 35 to 45, we may find 1 in 200 people with atrial fibrillation. If we take a population of individuals in the age range of 65 to 75, we'll find 10% of the population with atrial fibrillation, or 10 in 100. It's an age-dependent condition. And as we are getting better in treating human disease and expanding our lifespan, we are finding more and more individuals who are getting into their 7th and 8th decade of life developing this common arrhythmia. And unfortunately, developing atrial fibrillation has a number of associated morbidities with it. First and foremost, a significant risk of stroke. 10, 15 years ago, we did not have easy research tools to try and identify genes that caused atrial fibrillation. The Human Genome Project developed about 15 years ago, and the purpose of that project was to identify all the genes that make us up as human beings, including, of course, genes that are responsible for the electrical activity of our heart, and that may make us vulnerable to atrial fibrillation. However, finding the gene or the handful of genes out of 35,000 possible genes has always been a difficult task. Now, we are able to take a single individual and put their DNA on a chip or a USB key. Then we can go to the computer and do bioinformatic research. This allows us to look at every gene that makes up that individual and ask questions now about their unique genetic makeup that may be related to their condition, in our field, specifically atrial fibrillation. This has revolutionized our care. The digitalization of the human genome has given us tools to ask questions about the genetic basis of disease that we never had before. When we have families where these diseases run, I'll start that one again. On a number of occasions, we have families where atrial fibrillation seems to be common within the family. If we take the DNA makeup of every individual in that family, we can then correlate the unique findings of those individuals with atrial fibrillation as compared to those individuals in the family who don't have atrial fibrillation. The ability to do this now using a chip of the DNA for those individuals has made it much easier for us to identify specific genes that may be responsible for the disease in these families. This is the basis of our research now at the Heart Institute. And using these tools, we have identified some unique genes that are responsible for atrial fibrillation in families. And we're exploring and detailing this research as we speak. So the digitalization of the human genome on a chip is something we refer to as whole exome sequencing or whole genome sequencing, where we can take 3 billion DNA bases that make up our genome, that predict what we're going to be and look like as a human being, and put it on a chip, this whole exome sequencing. And this has only been available for the last 2 or 3 years. And researchers, such as our lab, are now taking advantage of these tools to ask questions about the genetic basis for common conditions like atrial fibrillation. And as far as I know, there is no other research laboratory in the world taking this approach. And we believe it's a feasible approach that is going to end up with some very interesting results. So fortunately, this research approach has been supported by the Heart and Stroke Foundation of Ontario. That's been supported by philanthropists in the Ottawa region. We have patients with atrial fibrillation who want to know about our research and want to have their DNA digitalized so we can analyze their genes and come to some answers as to why this otherwise healthy young individual has atrial fibrillation.